So I'm going to show a video that demonstrates how to load an SN60 WF Alcon intraocular lens into the cartridge. First, fill the chamber with viscoelastic to the back edge of the cartridge. Then, place a few drops of BSS over the intraocular lens to clear the lens of any debris. Then, grasp the intraocular lens at the edge of the optic-haptic junction. Confirm the alignment of the lens by checking it with the picture demonstrated on the cartridge. You want to make sure that the haptics are in a backwards S configuration. Use the cartridge to fold the leading haptic on top of the optic. Place the intraocular lens into the cartridge. Then, fold the trailing haptic on top of the optic and gently press down on the optic into the depression of the cartridge. Then fold the tips and advance the intraocular lens down the cartridge. Place the cartridge tabs into the groove and push forward until it locks in place. Then advance the plunger to the edge of the threads. Then screw a couple times to lock it in place.
Hi, I'm Jonathan Green, and I practice comprehensive ophthalmology as well as cornea and external disease at the University of Michigan. Today, I'm going to talk about the insertion of a one-piece intraocular lens into the capsular bag. Here we have completed removal of the lens nucleus. We first fill the capsular bag with a cohesive viscoelastic. The lens has been loaded in the cartridge and the IOL has been advanced to the end of the cartridge. Using either a spatula in the paracentesis wound or having the patient look towards you for countertraction, the cartridge is injected or inserted into the main wound just so the tip is past the inner aspect of the wound. The IOL is injected into the capsular bag so the leading haptic is clearly underneath the anterior capsule. The lens is then completely injected and the cartridge removed. A spatula or other instrument can be used to place the trailing haptic into the bag underneath the anterior capsule, as can be seen here. Once the trailing haptic and lens optic is clearly underneath the anterior capsule, the lens is centered and can be rotated to ensure the lens is inside the capsule. Finally, viscoelastic is removed using the irrigation aspiration handpiece.